Hello everybody and welcome to UroChannel. As announced last week, I will be uploading a couple of videos that explain what to do in case of major trauma. With the war in the Ukraine continuing and reports of casualties in the media, it is important for the average person to acquire some medical knowledge about what to do if confronted with severe injuries. There's a lot one can do without being a doctor. Other measures will require a great deal of courage and desperation. I'll come to that another time. If you're watching this, please share this video to someone you know in the Ukraine or to someone of whom you think they know someone in the Ukraine. Now, the basic approach to trauma care follows a simple rule that all professionals apply: A, B, C, D, E. These are the basic principles of the Advanced Trauma Life Support Program. Each letter represents an essential step, starting with the most life-threatening condition. Therefore, you should progress in the alphabetical order: A, airway maintenance; B, breathing; C, circulation with control of bleeding; D, disability with paralysis and nerve damage; and E, exposure, environmental control, especially keeping the patient warm and prevent hypothermia. A, airway maintenance. It's a fact. If you're unable to breathe for whatever reason, you'll die within minutes. So the first thing you have to do is to check whether there is anything blocking the airways. If the patient is able to speak freely, airway obstruction is not very likely. But observe and listen for a shortage of breath, wheezing sounds, obvious difficulty to breathe, rapid breathing, maybe no breathing at all. This could be due to an obstruction of the airways, which can be blocked by fractures, like for example a broken jawbone, fractures in the facial skeleton, or the windpipe can break as well and block the air from getting into the lungs. Open the patient's mouth and inspect the oral cavity for anything obstructive, like dislocated false teeth, vomit, in other words, anything that doesn't belong there. If you find anything, remove it. Think about the neck while you do that. Cervical spine injuries are common in multisystem trauma. You don't want to cause a paraplegia here. Try to stabilize the neck, preferably with a medical stiff neck, without rotating, flexing, or hyperextending the head and neck of the patient while doing it. Most probably, you will have to improvise with what you have at home. If you have an elastic foam, you could use that, or if you have heavy curtains, fold them a couple of times and form a collar out of it. Get someone to help you and stabilize the head and neck in a neutral position with both hands until the cervical spine is secured. An effective initial way of establishing a patent airway is to place your hands under the jawbone of the patient and lift the jaw up. Once again, think of the cervical spine. Don't move the head into extension while you do that. You have to hold that position until a definite airway is established by medical personnel. B, breathing and ventilation. A patent airway is not enough to survive. The patient will have to ventilate the lungs as well. This requires intact lungs, chest wall, and diaphragm. You will have to examine all of these components. For this, expose the patient's chest. Observe the chest movements with breathing. Are there any? Look for injuries, both on the chest and on the back, and gently turn the patient while still protecting the cervical spine to make sure you're not missing anything. Then use your hands and examine the thorax. Look for rib fractures. Pneumothorax is a very common condition that impairs ventilation. Pneumothorax means that air enters into the space between the lung and the chest wall. This will make the lung collapse and regular breathing is no longer possible. Causes of pneumothorax include rib fractures and open chest wounds, among others. If you see an open chest wound, open pneumothorax has to be suspected. If the patient is in respiratory distress, apply an airtight dressing and carefully observe what is happening, because sometimes you might be dealing with a so-called tension pneumothorax. This is a life-threatening condition where air is sucked into the pleural space with every breath and gets trapped there. Clinical signs of tension pneumothorax include rapid breathing, shortness of breath, rapid heartbeat, bluish skin. If you seal off the chest wound and something like that happens, open up the seal again. If the patient has a chest wound and is breathing normally, don't seal off the wound. If available, apply oxygen by mask. It is important to get professional medical help as soon as possible in these cases. This is it for this video. Circulation is up next. Hope to see you there. Bye bye.